Hi, my name is Tiffany Nonkel. I'll be doing a presentation on reagent preparation for Stago. The objectives for this presentation are you will be able to identify and prepare reagents for Stago. You will be able to identify which reagents need special handling, and you will know some of the consequences for not preparing reagents properly. Reagents that we use for Stago include neoplastin. This is used for PT. APTT. This is used for APTT. Fibrinogen is used for fibrinogen. Leotest D-dimer is used for D-dimer. Liquid anti-10A is used for anti-10A testing. Calcium chloride is used for APTT. Owen-Kohler buffer is used for D-dimer and fibrinogen. And Desorb is used for clean. Neoplastin reagent is used for PT. We use a solvent to mix with the lyophilized reagent. The solvent comes in a clear bottle. The lyophilized reagent is in a brown bottle. You will pour the solvent into the brown bottle and let sit for 30 minutes at room temperature. You will swirl gently. Next, you will add the stir bar by tilting the bottle sideways so that the stir bar will rest in the bottom of the bottle out to the side. You will then add the maxi reducer. Be sure to make sure that the stir bar is in the side of the bottle before adding, because if the maxi reducer comes down and traps the stir bar between it and the bottle, the stir bar will not be able to turn. You will then replace the capper without the rubber stopper. APTT. We use DI water to reconstitute this lyophilized reagent. It must sit at room temperature for 30 minutes. You will then shake vigorously because this reagent has latex particles in it. You will then remove the rubber stopper and replace the cap. Fibrinogen. Add DI water to the lyophilized reagent. You must let this sit 30 minutes at room temperature. You will swirl gently and remove the rubber stopper and replace the cap. Leotest D-dimer. The reagent is already prepared. One comes clear, the other one comes in an opaque, cloudy color. This comes in a set of two. You must replace both of them when you replace the dimer. This has to sit at room temperature for 30 minutes. You will add mini reducers and remove this rubber stopper and replace the cap. Anti-10A. This reagent also is already prepared. It comes in a set of two. You must replace both of them when you are replacing anti-10A. Let this sit at room temperature for 30 minutes. You will then add mini reducers. Remove the rubber stopper and replace the cap. Calcium chloride. The reagent is already prepared. You must let this sit at room temperature for 30 minutes. This one does not have a rubber stopper, and the cap does not have a hole in it, so you must remove the cap. Owen-Kohler buffer. Reagent is already prepared. You will let this sit at room temperature, and then you will remove the cap, because this too does not have a rubber stopper, and it does not have a hole in the top. Desorb. Reagent is already prepared. You will let this sit at room temperature. You will add a maxi reducer and remove the rubber stopper and replace the cap. There are a few consequences for not preparing reagents properly. First, a probe crash can result from not removing caps or rubber stoppers from set reagents. Some reagents do not have holes in the caps, and therefore the cap must be completely removed, such as calcium chloride and Owen-Kohler. The others have rubber stoppers on them, and they must be removed and the caps replaced. These caps have holes in them, so they are allowed to go on. Not preparing a reagent with proper solvent or DI water will result in unable to obtain accurate results for QC in patient samples. Neoplastin requires a solvent. D-dimer and anti-10A, calcium chloride, Desorb, Owen-Kohler, these do not require anything to be added to them as far as DI water or solvent. Fibrinogen, PTT, they require DI water to be made up and lyophilized and added to the lyophilized reagent. Not adding a stir bar will result in neoplastin congealing and inaccurate results. Not adding reducers will increase evaporation and affect patient results by changing reagent composition. Neoplastin, D-dimer, anti-10A all have reducers, and if that evaporation were to start occurring, then it would affect patient results and you would be getting inaccurate results. In review, reagents that get maxi reducers are neoplastin and desorb. The reason that these get maxi reducers and not mini reducers is the size of the bottle. The mini reducers are for Liatest D-dimer and anti-10A. Reagents that get Starbar is only neoplastin. Reagents that get rubber stoppers removed include neoplastin, APTT, fibrinogen, Liatest D-dimer, anti-10A, desorb. Reagents that get the caps removed include calcium chloride and Olvenkroller. I'd like to thank you for listening to my presentation. Hopefully this will help make you feel more comfortable in loading reagents onto the Stago and preparing them. Thank you.